Good afternoon. I would like to thank each and every one of you for being here with us at this live session from Masa University, Saujana Putra campus. I am Nur Fatin, lecturer from Faculty of Health Sciences, Masa University, and I will be moderating for today's session. Today's webinar, entitled The Science of Posture, Understanding the Fundamentals of Posturology, is proudly organized by the Faculty of Health Sciences, Masa University. Dear viewers, before we proceed further, I would like to give you a brief overview of the programs offered by the Faculty of Health Sciences at Masa University. We are from Faculty of Health Sciences and we have physiotherapy, medical imaging, environmental health and occupational safety and health department. Okay, so basically we have three schools or departments: School of Physiotherapy, Department of Environmental Health, and also Department of Medical Imaging. So as you see here, these are the programs offered by us. Why you need to join health sciences? Okay, first of all, it is a low risk of job redundancy. Okay, it means that it cannot be automated, and it also an opportunity to work in a variety of settings. Okay, so when you join health sciences, it is a career you can feel good about. We also have postgraduate programs like Master of Physiotherapy. Okay, and this is the entry requirement to enroll yourself in our master program. We also have bachelor degree programs offered by our faculty. As mentioned here, you can see as yourself. And these are the entry requirement to enroll yourself in our bachelor program. For diploma, we have three diploma programs. And this is the entry requirement if you would like to enroll yourself in our diploma programs. Okay, so we also have diploma in occupational safety and health. It is a 3 years program. And as you can see here, this is the entry requirement. Why you need to choose our faculty in Masa? Here, you can have interactive teaching and emphasis on clinical skills like face-to-face classes, and also we have online platform like our LMS. Here, you can have wide list of hospitals and institutions for clinical and industrial placement. And also, you can experience and dedicate yourself to international pool of academic staff here. We have a lot of study modes like conventional and also open and distance learning. You don't have to be worried about your financial, as we also offer scholarships like these scholarships. We also have some collaborations and affiliations with industries not only in Malaysia but also worldwide. This is one of our proud program which is endorsed and also held in Masa. We have student mobility program where you can experience yourself not only in Masa but you can visit other countries as well. These are some of the photos that we have. We welcome you to join us in Masa. Please contact us through Masa website or through our faculty Facebook page to know more about our faculty programs, or simply leave a comment. We will get back to you. Your questions concerning this webinar session can be listed in the chat box. Ladies and gentlemen, let go back to our webinar. I would like to introduce you a little bit about what we are going to listen today. Posture refers to the position and alignment of the body's various parts, including the head, shoulders, spine, and limbs in relation to one another and to the surrounding environment. Good posture is essential for maintaining overall health, preventing musculoskeletal issues, and promoting optimal physical function. Proper posture distributes the body's weight evenly, reduces unnecessary strain on muscles and ligaments, and also allow the body to move efficiently. Now, let me introduce you to our speakers today, which is Mr. Vijaya Pradeep Ramakrishnan. Mr. Vijaya Pradeep Ramakrishnan holds a master's in physiotherapy, specializing in orthopedic physiotherapy from TNMGR Medical University, Chennai, India. He has been a clinician and also an educator for more than a decade. Ladies and gentlemen, please welcome Mr. Vijaya Pradeep. Mr. Vijaya Pradeep, the screen is all yours.
Thank you, Ms. Fatin, for the wonderful introduction about me. A warm good afternoon to everybody who are listening this webinar. So I'm as per the introduction already that was given. This is Vijay Pradeep from Masa University. I'm much delighted to present this webinar and discuss some of the topics that are related to our body and also the physiotherapy to you in this wonderful time. Okay. Once again, I thank Masa for making this arrangement. Let us move on to the slides. We will just discuss about the posture. Let me introduce. I'm from the Faculty of Physiotherapy, Masa University. So this is the topic that we are going to discuss today: posture and posturology. First of all, we physiotherapists will be dealing with this posture. Many a times we do have many kind of lectures that is related to this posture, how the body systems are aligned and how it is working and how it is maintaining the proper position to bring back the musculoskeletal movements in a proper way. So now we are going to discuss something about the science of posture to understand the fundamentals of the discipline posturology. So here are the contents that we are going to look in today's webinar. What is posture? And we are going to list some curvatures of the spine that is present and it may be developing later in the life. Then postural control. And we are going to recognize the posture and the new concept which is traumatognatic system. Then we are going to interpret the posturology with all these aspects, and we are going to analyze the posture, and we are going to listen about the advanced techniques of analyzing the posture these days. So the aim of this session is to provide an overview of postural system and exclusive discipline that is dealing with the posture, to know about every single details of the posture, that is the posturology. So, we physiotherapists mainly dealing with the patients, those who are having problem with the musculoskeletal, neurological, and whatever the domain it could be. We are treating multiple cases, and every patient will be having some problem with their posture. So this posture is the main thing that shows the patient's presentability and how they are performing their activities and how good they are at their activities and everything. So we can say this as a mirror, or altogether it's a very good indicative sign to see how healthy the patient is. Okay. So, 93.9% of physiotherapists say it is important to know about the posture education. As a physical therapist, we need to know about the posture very well to deal with the conditions that the patient presenting to us. So this is what. It is not a single thing that the posture is set of interactions between the musculoskeletal system and also the central nervous system through the afferent and efferent pathways. So in the connection, the interconnection between these systems will make the posture to be in a normal way to do all the activities in their daily life. So keeping your body in state of musculoskeletal balance, that stuff that supports the supporting structures of the body against injury or progressive deformity. So this posture, if the posture is good, then the people will be moving and their mobility will be healthy. And if it is not good, if it is not into this normal circumstances, then they will be facing multiple problems in their life, in their daily activities and their well-being. We're going to listen something about the spinal curvatures that we already would know about it, and anyhow we will be just recollecting the things that we already know. So the spinal curvatures, these are the curvatures that will be present in our spinal column, that is the vertebral column. We used to say it as an axial skeleton. Along with the skull, we will be knowing this as an axial skeleton. It will be forming a curvature, and we can divide it into two curvatures. Initially, the dorsal kyphosis, that means the kyphotic curvature or C-shaped curvature will be there during the birth, and later in our life, once the baby starts crawling and sitting and doing every other activities, the secondary curvatures, that is the lordotic curvature, that will be developing at the cervical and the lumbar region. And with this concept, we are knowing that the movement or the position of the person is much important to make many kind of changes inside the body. As with these concepts, we are knowing that the curvatures are being interplayed because of their movements. So these curves are formed and stabilized around 5 to 6 years after the proprioceptive maturation of the foot. Once the baby attains the age of 5 to 6 years, and after attaining the proprioceptive growth, this posture, the curvature will be growing. Okay, and then it also will be necessary to maintain a proper balance. That's these three curvatures maintain the balance, and they provide support and resistance against the longitudinal pressures. So the longitudinal pressure from top to bottom will be going towards the ground. As we know, the gravitational force are all acting on all every one of us in the universe, and the gravity will be attracting our body, and the body's center of mass will be going towards the ground. That will be called as the line of gravity. We would be knowing that. The complete development of the postural function takes place around 11 years of age. So every person, when they born, the complete maturation of these curvatures will take place 11 years of old. From the 6 years, the curvatures will get to develop, and after that, it will be getting stronger, and the postural function of the person that will be taking place, or otherwise it will be starting from the 11 years of age, and that will be stable unless or otherwise any other damage that occurs to the person. Till the age of 65 years, it will be the same postural function. So we just will look on something to the posture. The term posture means the position of body in the space, how we are positioning our body or how we are aligning our body in the space. Now I'm sitting and you people are sitting or maybe standing. So sitting can be called a sitting posture and the standing can be called standing posture. It is an automatic and unconscious position, and it represents the body's reaction to the force of gravity. So, by knowingly or unknowingly, by voluntary or involuntary, the gravity is acting on us, and that makes a specific role to maintain this automatic postural function. And it is also maintained through the contraction of the skeletal muscles. We know, as we know, the muscles, the muscular contractions, there are some muscles in our body which were called tonic muscles or the postural muscles that will be always in a contracted state to maintain the body in an erect position. And thus that erect position is the result of the involuntary contraction of those postural muscles. And the opposite group of muscles, which is called as the phasic muscles, that will be working whenever it is needed. So we need to do anything which is necessary, then we have to stimulate the muscle, then it will be working. For example, our abdomen. And if one person is having a proper posture without any deviations in the posture, it is to maintain the balance with maximum stability. So the person will be so stable if their postural structures are functioning normally. And if it is to be in the normal way, a minimal stress of anatomical structures is also needed. So many of us, those who are spending our entire 24 hours a day, we will be working for some duration of time, like some work for 8 hours, some work for 9 hours, but entire day we are doing some physical activities, right? So if you are doing the physical activities, it will be healthy and not harmful to the anatomic structures if you do it in a proper way. But if you are stressing some extra load to your anatomical structures, it starts degrading its function and it tolerates for some time. After some time, it may not be able to tolerate, then it elicits some problems to you. And the next thing, it should be a minimal energy consumption. If you are sitting or if you are doing some work, you should not think that you are exerting more. If you are thinking that, then some group of muscles are overworking or some groups of muscle are compromising. So if it is normal, the minimal energy consumption is the main thing. There are some key concepts to understand about this posture. If it is posture, we're going to discuss about the concept of spatiality. So the spatiality is the space that is occupying the place where you are standing or sitting. So the position assumed by the body in the three directions of the space and the spatial relationship between the various skeletal segments. We will be knowing about the planes, right? The sagittal plane, coronal plane, and the horizontal plane. So on all the three planes, the three-dimensional planes, on all the three directions, the body will be occupying some space in the universe, and that is the main thing, and that is called as the concept of spatiality. Then the concept of anti-gravity. Gravity is the fundamental external force of posture adjustment that will be happening on all, as we discussed even earlier. And the postural balance is response to the gravity. If the posture needs to be balanced, gravity should be providing some force towards your body. Moreover, we will be knowing that the ground reaction force. When you're standing on this place, if the place is stable, you will be exerting. Your body will be getting some force from the ground, which will be called as the ground reaction force, and it is much necessary to make your body to be stable. We may not be able to stable stand on the water or any air or any other medium. Okay, so even over the mud, we may not be able to standing stable. So the stability is much important, and that is the reason why the gravity plays a major role in maintaining the posture. And then the concept of balance, the relationship between the subject and the environment. So we have our special senses to know what we are doing, why we are doing, and what about the surroundings. So with the information that you're getting from the surroundings, your body system will make some manipulations, and it processes the information, and it makes you in a proper posture. So it depends upon the environment, your posture will be accommodated accordingly. We have ultimate posture, purpose of posture, that is to maintain the equilibrium in both static and dynamic conditions. For example, if you are doing some activity or if you are not doing any activity and simply staying stable, so even then the equilibrium have to be maintained. Okay, so when you are doing some activity, as long as the center of gravity that is stays between your base of support, which means the line of gravity of your body that stays within the base of support, you will be much stable. And whenever it comes out of the base of support, your body will not be stable, and we can say it as an awkward posture. You may not be able to hold that posture for a long while. That makes you more tend to follow the fall. The balance is due to the interaction between different main and secondary anatomic structures. So these things that we discuss, all of the structures, like even the musculoskeletal structures and the efferent and afferent pathways that we discussed in the earlier slides, all of these will be having the interaction between some anatomic structures. So they are some main structures and secondary structures. We will discuss what all those structures are. So this will be the main thing, that is the central nervous system, that is our brain. The brain will be following its doing its function, and it will be following the pathway. These are some organs that will be maintaining the posture in the proper manner. The first will be the vestibular organs that is present inside our body, specifically in the ear. We will be having the vestibular organs, and that will be containing the semicircular canals, will be maintaining the flow inside properly, and that makes you to stand properly and or walk properly. Then the second one will be the cerebellum, that is a part of our brain, and then the cerebral cortex, and then the reticular formation. So these are all the main and major structures that will be accompanying the posture to make it perfect. If any problem that occurs to these structures, that may be resulting to the posture to be a deviated and a faulty one. And there are some secondary structures which are also responsible for making this proprioception better, the posture with the proprioception. So the exteroceptors, the tactile receptors that are located under the foot, that is under the foot, which will be measuring, which will be analyzing where you are and what you are, how the surface is. And then the visual receptors, without the vision we will not be able to attain the proper posture. So the vision plays a main role, and also the proprioceptors that is located in the tendons. The proprioceptors, the joint receptors that are responsible for knowing about the position of the joint, what kind of position the joint is attaining, and what needs to be done later. And then the joint capsules are the muscles. These are the secondary structures, which is also playing a main role in maintaining the proper posture. The balance, the static balance, the ability of the body to maintain the static position. But if you're standing, your standing position have to be maintained without any disturbances. You should not feel like you're not balanced or not able to maintain that position. It should be stable. That is called as the static stability. And as I said already, the curvatures are the main thing that is making us to stand straight, and interrelation between these curvatures with the mid-sagittal plane that is resting over your sacrum, the body will be stable. And if it is not following that straight pathway, if you are bending forward or going backward, then you will not be in a proper state of maintaining the balance. That will not be a static balance. Then your body started accelerating. If you start giving some other movements with respect to the anterior tilting of your spinal segments, you will be moving. If you're not moving and if you're not maintaining the proper stable posture, then the probability of falling is too high. Then the dynamic posture, that will be the ability of the body to maintain the stable condition during the different daily activities. Depends upon the surface that you are present. You need to do, you need to do make some changes to your intensity of walking, speed of walking, and many other things. Depends upon the situation where you are. And even then you need to maintain the balance, that is called as the dynamic balance. And we can say the posture is functional if there is no pain. If your body has no pain, we can say your posture is functional. Your body's ability is functional. That means absence of pain and normal muscle tone, absence of muscular tension, then balance of kinetic chains and preservation of the harmonious relationship of skeletal segments. So if it is pain, for example, if you are feeling some pain, we can say that your anatomic structures are disturbed. So as the heart levers, bones will be doing all the functions and all the activities of the body, and the structures which are present around the joint or around the bone will be specifying or keeping the particular region of the bone to be intact and to maintain the much much congruent and that region. If the congruence maintaining structures which are not in a proper way, or if it is stressed too much, then it starts eliciting the pain, and then which makes some abnormal changes to the muscle also. So the muscle tone also will be changing if it is a problematic position, and absence of muscular tension. If you are normal, then the muscles also will be normal and it will not be having any tensed. And if it is not in normal range, the muscles will be tensed. So we need the interaction between these kinetic chains and the harmonious relationship of the skeletal segments. So, with all those things, we can say the posture is functional. That means the person is able to walk, able to run, able to do all his physical activities without any problems. And we can also say if it is non functional with some of the reasons, the main thing the patient will be presenting pain. For example, many of the patients that we are treating will be coming to you with the problem of musculoskeletal origin. That might be because of their work. There may be their occupation or any other history of injury or their daily activities. Anything can relate their body to get pain, but the pain is the resulting factor of the abnormal things that has happened already inside the body. And then muscular dystonia, which means that the muscle tone will not be normal, and then the loss of harmony of the skeletal segments, abnormal muscle tension, and imbalance of the kinetic chains. So if all these structures are normal, you will be functional. If all these structures are not normal and deviated in some ways, then we can say that the body is not stable and the patient may not be able to function by himself independently. We need to know about the postural control. There are some control which needs to be done with the interaction of the multiple systems in the body, and it is an isometric and motor behavior which represents a stable starting point of execution of the movement. So from the stable point of view, the movements will be started. Its effectiveness depends on the availability and reliability of the information from the vestibular and the somatosensory system. So as we know, these vestibular system and also the special senses that are responsible for making our posture in a proper way, we need to know about this vestibular system, because if the vestibular system is not functioning properly, the patients will be feeling lack of balance, and they may not be able to walk properly. They may not be able to attain whatever the position they are trying to. And also the somatosensory system from the peripheral parts of our body, it also needs to gather the information that is happening around the body or around the environment, and it will be taken to the central nervous system. When any of these components is altered in the pathological way, the oscillation of the body occurs. The body will not be maintaining its proper posture or proper stable posture when the person is standing. And when he tries to move in a walking or any other patterns that he is trying to, it may not be possible for the person to do those without any problem. That is called as the pathological way that will be resulting because of the imbalance between any of these structures, and also the postural muscles. A large number of sensory motors, integrated reflections at different levels of the central nervous system is also playing an essential role with an automatic and extremely precise manner to maintain the proper postural control. And these are the systems that are responsible for making the proper posture and proper stable posture of a person. The first thing is the vision, and then the vestibular system, and then the proprioceptors that is located under the foot, and then this all structures will collect the information from the environment, and the collected information will be going to the brain, to the concerned centers, and the information will be processed, and it will be creating some commands to the muscles. Then the muscles will be performing the activity, then the movement will be the resulting thing, and again the cycle will be starting. So this is called as the postural control. We just will be seeing the information, how what are all the information that are being collected. The information from the visual system will be by the retina that collects the information from the environment, and then the skin systems, because of the presence of the receptors that is situated under the foot, it diagnoses the place where you are standing, whether the surface is okay, whether it is the stable one or it is unstable or needs to do some changes. All these informations will be collected by the receptors that is present under the feet. And then the vestibular system, then the Golgi tendon organs and the muscle spindles. We can moreover say this as a proprioceptors that is located near the joint. That senses about the muscle contraction and the length of the muscle, how tense the muscle is, and it will be making the changes to the body according to the thing that is attained by the muscles and the tendons. These stimuli are transmitted to the higher centers through the interneurons and the motor neurons in the spinal cord. Then the information once reached the spinal central nervous system, it will be processed and recorded in the form of body image. So once these informations are collected, the brain will be making some processings, and it will be creating the information in the form of image. And after that, they are transmitted to the muscles, where it commands the muscles to do some activity. And this command of the muscle, of the brain to the muscle, which will create an activity, then the muscle will start contracting, and that will be making some movement to the skeletal system. Then the posture, that means the mobility of the body will be starting. This is the next thing, which is the stomatognathing system, which is the recent evidence that is showing about the importance of the multiple systems of musculoskeletal systems of the body to make the posture orthostatic. If it is the goal to the body to keep your body in a stable posture, that is simply said as posture orthostatic, the maxillary and mandibular bones that plays a main role, that actively participating in maintaining the correct position of the skull, with the flexors and extensors of the neck, and also the muscles above and below the hyoid bone, and also the muscles of mastication and the shoulder girdle muscles. So these are the things that are also responsible for making the proper posture. So combinedly, altogether, these systems will be called as stomatognathing system, and the stomatognathing system is also essential to maintain the proper in a balanced way. Biomechanically, it is considering a single functional anatomical complex cervical mandibular interaction. The changes in the mandibular position induce variations to the posture. So the maxilla and the mandibular position matters the proper posture. If any changes that occurs to this components, that can result into abnormal posture. That is the reason why we are making it as a complex cranial cervical mandibular components. It has been demonstrated that the mandibular position changes the electrical activity of the postural muscles, the position of the mandible. The studies reveal that position of the mandible that also changes the muscles contracting activity, the electrical activity of the postural muscles, which are the muscles which are responsible for making the proper posture. And some experimentally changes in the plantar stance influence the basal muscle tone of the upper temporal muscles. From a physiological point of view, nociceptive stimulus in the muscles causes a stimulation of the motor neurons of the flexor and same time an inhibition of the extensor muscles. So if any nociceptive symptoms that arise, nociceptive signs that arise, painful moments, painful things that is arise from the muscles, it inhibits the muscular activity, it inhibits the extensor muscles, which are responsible for making us erect posture. The extensor group of muscles will be inhibited, and that results to be a muscle imbalance, and that causes some deviation in the posture even. Now, we are moving into the term posturology. This is the discipline that deals with the scientific and clinical study of the posture. Increasingly these days, non-conventional medicine to study about the relationships between various body posture and the function disorders, especially the chronic painful diseases. Those are such as the headache, whiplash injury, fibromyalgia, alterations in mental and bodily functions. Posturology is the important thing to recognize all these problems in respect to the anatomical and functional relationship between the postural attitudes and the pathological conditions. So, we are getting multiple patients with these kind of problems these days. They comes to us to get treatment, and we need to know about the posturology. Even we will be diagnosing them whether their posture is normal or not under some circumstances, and it is the way to study the posture from different points of view on the basis of the neurophysiological model. We can say it is based on the study of postural tone and the balance functions. And if it is the biomechanical model, we can say the body attitude, gravity, organization of kinetic chains, anti-gravity activity, then spinal reflexes, vestibular reflexes. These all will be playing a major role in understanding the posture and maintain the posture in the proper way. So if we need to understand the posture, then the body attitude that plays a major role in response to the biomechanics. Then the gravity, if the gravity is more acting on the body, and the line of gravity that is going to the ground, if all this occurs in a proper manner, as we know already that the proper posture can be maintained much stabilized if the line of gravity that passes within the base of support. So as long as when the line of gravity stays within the base of support, your body will be stable. If it comes out of the base of support, your body will not be able to maintain that posture for long. If you maintain that posture for long, then muscular imbalance will be happening. So the gravity is also playing a much important role in maintaining the posture. Organization of the kinetic chains. So this is the interaction between the multiple joint structures present in the body that plays a major role in maintaining the posture, and also the spinal reflexes and the vestibular reflexes that are collected from the systems. Psychological status, the later, the most important thing among all these. If all the structures even are normal, the person may be feeling imbalanced. That could be because of psychosomatic reasons. The person may be with a state of anxiety or any other problems or mental illness that also can result into bad posture even without the problem in the anatomic structures of the body. Postural pathology is not a very specific disease with a specific cure. We cannot say the postural imbalance is a disease. This is because of some other reasons that are presenting inside the person's body. Some of the anatomic structures or any other systems, they may be a problem, and that is the reason why the proper posture may not be possible for that person. So, it is a set of symptoms that may have been caused by some of the problems or pathologies that occur to the visual system, or a simple breach, then oral problems, proprioceptive imbalance, vestibular imbalance, and also epithelial problems. Any of these conditions, when the person is presenting with any of these conditions, their posture will not be properly presenting. They will be having some deviation in their posture, and this deviation can be a problem, but that not be a disease. We will be having just abnormal posture that is the result of some other structures present in the body. Then, the main symptoms of the postural disorders are represented by headache, pains in the spinal level, where neck pain, back pain, low back pain, anything. Pain in the arms and legs, difficulty performing physical and daily activities. So, when the person comes to you with any of these problems, we will be just addressing their pain as a result of the internal changes, but the understanding about the posture which makes you to diagnose them in a more precise manner. So the headaches, pain in the spinal level, everything comes because of maintaining wrong posture. If the person is working in a seated posture, proper ergonomics have to be followed. If they are not sitting in the proper manner, then ergonomics may not be maintained, and that can result problem to the anatomic structures. That creates the pain in arms and legs, and also this results in poor function and disabilities, or in their daily activities may not be functional. These are associated with some disorders that are pathogenic traumatic injuries, inflammatory processes, then congenital or acquired deformities, degenerative processes, tumors. Some of these problems can severely damage their posture. The postural analysis allows the therapist to visually evaluate the patient and to determine an ideal position. So these days, with the development of recent techniques, we can analyze the person's posture with some specific tools. We're going to see what they are. The ideal location we checked on the three levels: the classical concept, the axis and the planes. We do not come out from these axes and planes. Always we will be analyzing the patient posture. We will be analyzing the person's posture in all these three planes. The frontal plane posture, in that we will be checking the anterior and posterior segments or structures of the body, whether it is aligned normally or not. Even with the help of the posture grid, we can analyze the person's body structures alignment, aligned properly or not. And the main second way to analyze the second plane and then the another plane, all of these three planes will have to be analyzed. If it is analyzed, and you can easily notice the problem or any of the deviation that is presenting in these planes. So that was the technique we were using all day long in our physiotherapy to understand about the posture. The recent systems, recent inventions that came to diagnose the problems so easily, that is called as stabilometry. The stabilometry is the technique that evaluates the stability of the person. It is an apparatus used for the evaluation of disorders of balance based on the translating mechanical oscillations of the human physiological gravicentrum into electrical signals, which are amplified, recorded, and analyzed. The person will be standing on the platform, and the platform will be designed with baropodometric platform, and that measures the amount of force that is being received from the person. The person will be standing on a platform, and they will be asked to do some tasks, and how far, how balanced they are standing, and what kind of force they are imposing over the platform will be measured with computerized techniques. So they made to stand on the platform, and they will be on monitor to measure about the pressures that are being exerted to the platform. In the last years, a new and modern technique which is called spinometria is also used. The digital spinometria is an apparatus for optimal optical detection in three dimensions of morphology of the trunk, based on the principles of rastereography of bright stripes grids combined with triangulation algorithms. So this is the technique. We just make a person to stand in front of this platform, and computer will be sending the impulses, and it will be grabbing the information of the spine, how properly it is aligned. So this is the alignment of the spine. The spine alignment will be the main thing to diagnose the problems that is related to the spinal curvatures. In the earlier sections, we discussed about the spinal curvatures, the thoracic kyphosis, and cervical and the lumbar lordotic curvatures that were always present in a person's body, and that will be developed, and it will be maintained till the years of 65 years of the person. And if there is any deviation present in this posture, that have to be measured. We were using the technique Cobb's angle and some of the techniques to measure the angulations happens to the spinal segments. And these days, spinometry is much used. which can clearly take the activities of the person and the changes that are occurring and that are developing in the spine with response to the long axis. It is an excellent way of for evaluating the shape of the spine as it reproduces the extent absolutely precisely, accurately for zero point 0.2 millimeter, the sagittal profile of the column. The spinometry is able to make accurate assessments of the vertebral curves by measuring the most important parameters, biomechanical and postural. It also shows with sensitivity and precision the alterations that jeopardize the spine. So this technique can extremely be helpful to know about the person's spinal alignment. So many of the persons, those who are working with the computer, will be monitored in majority of our projects, and the researchers will be concentrating to improve their posture. But the employees, those who are working with multitask, those who are working in the construction site, or those who are working with the writing documents, or those who are working as a painters, there are different kinds of employees present around the world. And all these positions, if it is need to be maintained properly and the patient thinks to work normally, it needs to be maintained properly without any deviation. For that, the spinal curvatures are necessary. So these postures will be dependent on the spinal curvature. If the spinal curvature is normal, then the posture will be normal. If the curvatures are not normal, it deviates in some way, then the patient's or the person's posture will not be normal. Okay, so the normal posture will be the result of proper curvature maintenance. So with the development of this curvature itself, we can understand that the curvatures can be modified according to the body activities. So, as we know, when the child does some activity, it made the child to develop the lordotic curvature. So, with this point, we can know that the change of body positions can also make some changes to the spinal curvatures. So, if you maintain a proper posture, your spinal curvatures will be normal. But if we stress our periarticular structures in some abnormal positions, when we attain in such a way not to maintain the spinal curvatures in the normal circumstances, then the structures will start to degrade and it starts to develop multiple problems. So the periarticular structures, that is the structures present around the joint, will be having some tolerable level and that have to be maintained within that. If you do overactivity to stress all those structures, the structures will not be helpful for much longer time. It will not be able to tolerate for years and years. Then it starts developing the pain, it starts developing the fatigue, then it starts developing degeneration, and severe damage to that structure will next pass the information to the adjacent structure that is present next to the periarticular structure. If it is spine, initially the muscles will be experiencing some pain, and it gives you some warning signs. And if that warning signs are modified, and if you did some changes to your position according to the information that is coming from the muscle, if the muscle is giving you pain, then we need to advise the person to do changes accordingly to maintain the proper position by attempting to maintain the proper ergonomics. But if we ignore, then the process will not stop. It will be developing. It will be developing to the next stage. Then the next stage of development of disease will be the resulting thing. Next to the muscles, we will be finding the ligaments. The ligaments that is present near the vertebral column, that is maintaining the integrity of the spinal alignment, will be damaged. If the ligaments are damaged, as we know that these are the structures which are responsible for making the integrity of the joint in a compact manner, it will be damaged. If it damages, then it may not be able to maintain the proper stability. If the proper stability is not maintained, then it creates the problem to the next adjacent structures that is present next to the ligament. So we are going inwards now. The next thing will be the disc, the intervertebral disc. The disc will be bearing the next abnormal activities of the body, and it tolerates for some time, and if it is again exceeded, then this also will get damaged. Okay, this is how our pain and damage to the body structures are being originated. So the posture, the maintenance of the proper posture, that makes a crucial role to know about these systems to maintain a proper health. Okay, so this is what I was about to discuss with you all today, and here we complete the session. And I'm looking for the Q&A session. If you have any questions, please arise. And thanks for listening. Um, I got a question from Mr. Rahul. Are there any exercises or stretches that can help me to get good posture? That might be his question. To get a good posture, we should be doing some activity. So too much of anything is good for nothing, and doing nothing is also not good for our health. So we need to maintain an integral health to our body to maintain a proper posture. So we need to use the body wisely to do all the activities without stressing the spinal structures. So if you experience any discomfort when you're working, we just have to change the position. In such a way, we can stop getting damage to the structures. And if you got any problems, the problem have to be diagnosed properly. But you can also even manage your problem by doing all the activities. The body is designed to do all the activities, and we people are not doing all those activities properly. So if the activities are done properly within normal circumstances, we can do all the activities and all the mobility things in our body that maintains you in a good posture. If you are not doing anything and maintaining a sedentary lifestyle, then we may not be able to get a proper health, and we will be disturbing the anatomic structures. Some of the anatomic structures will be working too long, and some of the structures which will not be working. Okay, but we don't want that. Even the systems that is present in the body needs to be interacted, and that needs to be balanced. So we have to do a balanced activity by including some aerobic exercises that can be helpful to you, sir.
Thank you, Mr. Vijaya Pradeep. Is there any question? Yeah, we have one more question from Mr.
Yes.
Rahul.
Is there a recommended sitting posture that can help prevent posture related problems? Yes, sir, of course. We have some specific position. As long as we maintain the curvatures normal, then we can avoid these problems. So there are many things. Much of the physiotherapists, as I said in the earliest, 93.9% of physiotherapists are thinking that postural education is much important. And they say 98% of them say that sitting posture plays a main role in affecting the postural related problems. So, we need to just maintain the curvatures. We need not to give any stress to the anatomic structures. If you maintain the normal curvature, the cervical should be lordotic. That must not needs not to be supported when you are sitting and working. Then the thorax and the lumbar region. The more specific region will be the lumbar region, your low back, that needs to be supported properly. If it is not supported properly, but you will be working and sitting, and you will be working for so long, for some duration of time. If it is maintained, that elicits some problem to the muscles. Okay, whether you are sitting straight or if you are sitting slouched, some structures of the body will be getting damaged. So it's better to stick on to the curvatures to maintain the spinal curvatures in the normal circumstances, just like that how it is present. If it is maintained with back rest, we can avoid the problem. So we may not be able to sit straight for longer duration without back support. So sitting straight is a good thing, and that needs to be maintained without the muscular interforce. If the muscles are too overloaded and working for longer duration in an abnormal manner, that can result you getting problem more severe. So maintaining this, we can have a proper back rest in our chair to maintain the back to be in a rested position that can avoid the muscles to put overload. So, sitting in a proper way, in such a way to maintain the spinal curvatures, can be the best solution for the postural problems. Yeah.
Do we have any other question from our audience? Yeah, that's it. So thank you so much, Mr. Vijaya Pradeep. To our wonderful audience, thank you for joining us at this webinar. We look forward to your comments and participation at future events hosted by the Master University. Please fill in the survey form which can be found at the comment section by the end of this webinar. ESET will be awarded. In case of any further queries, you can contact us through Masa website and also our social media. Okay, guys, have a pleasant weekend.
Thank you. Thank you, Ms. Fatin.